Hi, I'm Paula Nutting, your musculoskeletal specialist, and today we're going to look at shoulder pathologies, specifically our shoulder joint. You might have some clients that come in to see you that complain of a pain in arc, so they're fine down here. As they come up through there, they get painful, and then they can clear it up and it feels fine when they get to the very top. Now we've got multiple ways that we can treat this. One can be just simply softening and loosening off the soft tissue around the area, pec major, pec minor, bicep, rotator cuff, and sometimes we can even come in and punch up that little subscap. But it could quite often be the first rib. And in actual fact, that's what I'm going to show you today, is a little bit of a joint mobilization on the first rib. We're going to use Kevin's left-hand side, not the right-hand side, and I'm going to show you what we do. So we're going to get his arm up on the non-treatment side, and you can see he's now got a diagonal angle for his clavicle and his scapulars. And then we're going to take the webbing of our thumb and finger, and we're going to feel for that first rib area. So we're going all the way down the lateral structures of that cervical spine on the left, and you should be able to palpate, especially if that first rib is elevated. So I can feel it, and it will be quite tender, yeah? Yeah, so I'm going to bring my web, cut right into here, and I'm just going to let him rest his head so it's passive movement. And I'm going to push down on that first rib. I'm going to mobilize it for probably about 12 to 15, just until you can start feeling movement. Now once we've mobilized it, we're going to do a bit of a muscle energy technique. So what Kevin's going to do is he's going to try to laterally rotate to his right for me. So pulling around and up. It's about 30% to 40% maximum of the effort. They're going to hold it for 10 seconds. Take a breath in for me, Kevin, and relax the head as you breathe out. And then once he's relaxed, we're going to mobilize again. So we're going to do this mobilization 3 times. I'm only going to do it twice because you guys are going to be able to do it 3 times. Again, you're going to turn your head up for me, rotating and pushing his ear into my hand and then trying to turn so he's looking over that right shoulder. Take a breath in and relax on the out breath. Good work. So we would do 3 times, but we're also going to do another mobilization and do a bit of a contraction on the same side. So this time Kevin's going to push his head, lateral flexion, into the outside of my arm. So push down for me without rotation. So we're going to go straight down. How's that feel? Mm-hmm. Yeah. So he can feel that he's got some stiffness through that joint, and relax. It feels more tender than the application that you're putting on, but he's actually getting some good spring. Can you feel the difference there? Yes, I can. Yeah. Okay, we're going to do one more time with this. So that's about 12 to 15 springs, and lateral turn to your left. So straight down. Fantastic. So you're going to apply 3 on each side. So 3 rotations and 3 lateral flexions. Big breath in. And relax on the out breath. Another trick to this is to make sure that other arm, the treatment arm, is down vertical with the hand internally rotated, because it will just allow a little bit more space in that glenohumeral region. Can you take that arm up through range for me? So up it comes. Now that was quite stiff earlier today. How's that feeling for you now?
Better, much better.
Yeah, okay. I'm Paula Nutting, your musculoskeletal.